Ladies and gentlemen, may I have your attention, please?
Covering both sides of the big issues with the analysis you trust on News Radio 1040 WHO.
We talk a lot, and we talked about it in the first couple of segments, just your favorite Thanksgiving traditions. But one thing that I personally am very cautious of is just trying to maintain your health, especially this time of the year as well. And I thought it would be a good time to talk with cardiologist Dr. Fahmi Farah, who's joining us on the Lamarca Law Group Newsmaker line. And doctor, thank you so much for joining us today.
Hi, thank you for having me.
Okay, so I guess this is the kind of time of the year a lot of deaths from cardiac arrest, other illnesses increase significantly because of diet changes, and people are drinking alcohol a little bit more regularly. People are stressed out because this is a real bustly time of the year for many different reasons. So how can you, let's start with the stress aspect of this. My family has a history, especially on my father's side, of having cardiac issues, especially as aging occurs. What's one good way that we can kind of protect ourselves from intense stress this holiday season?
Yes, stress definitely contributes to the increased number of heart disease and heart attack that we see during this time of the year. One good way of minimizing it is, of course, continuing with exercise and not deviating from your routine of healthy diet. Stress management, also good sleep, it would be a good idea, not skipping out on sleeping. Financial burden during this time of the year from needing to buy gifts for everybody contributes significantly to the amount of stress that we have. So, budgeting and not going over that budget is a good idea to minimize the stress. Meditation, just doing some relaxation techniques are all good.
Relaxation is something I've tried to do. I've started seeing a counselor to kind of just help me maintain my own personal thoughts, and it honestly feels like it's helped my heart and my blood pressure just kind of relax just a little bit, knowing how to kind of prioritize what I am worried about, what I'm not so worried about as well. So we talk about not just that, but the diet part of it as well. It is Thanksgiving, doctor. I don't understand how we can expect ourselves to not indulge in too much food or too much alcohol, depending on your lifestyle choices. But what are some ways, diet-wise, that we can enjoy the holiday season while also being mindful of our health?
Yeah, there are two things when it comes to diet during the holiday season. Number one is some of the food that we consume are just generally unhealthy during the holiday time. It usually has more butter and lots of salt, which is sodium. So those are the two things that usually get people into trouble as far as diet goes. So my advice on that would be to prepare the food in a rather healthy way, avoid as much butter, and definitely avoid the amount of salt consumed. In fact, salt is what gets people into the hospital due to heart failure. We see 33% increase in heart failure-related hospital admissions post-holiday. So those would be the ways to, minimize that risk. And the other thing is alcohol consumption. That's very important because during the holiday season, either due to stress or from pure indulgence standpoint, people do consume more alcohol, and that's the other reason why heart disease rate goes up. So those are the two things. It's all about moderation. You do need to be able to enjoy your holidays, so keeping moderation in mind is the key.
Speaking with Dr. Fahmi Farah here on the Lamarca Law Group Newsmaker line. Doctor, you talked about that and just the obligation aspect of this, and that's something that I find to be very intriguing, and it's been kind of a challenging year for me just to try to process everything and all my ambitions and all the different responsibilities that I have and everything that I'm trying to accomplish on a day-to-day basis. And as the year winds down, you feel that pressure just a little bit more. Is there a way that you can kind of tell that you're unwell besides, actually having some sort of episode, especially when we're talking about your cardiology and your blood pressure and the systems that you have there?
Yeah, so there are risk factors that can lead to heart disease, and some of the key risk factors would be high blood pressure, high cholesterol, diabetes, smoking, all of those, having family history of heart disease. So you already know which risk category you fall under if you have any of these. On top of that, knowing the symptoms and paying attention to those symptoms are very important. So some of the symptoms to watch out for would be chest pain, chest tightness, shortness of breath, indigestion symptoms that are severe and not going away. Those would be the key symptoms to watch out for. And if you're having any of those, then, seeking attention, seeking medical attention in a timely manner rather than waiting is also important.
Okay, last question for you, doctor. What are some of the other illnesses besides just kind of that general heart attack style issue should we be on the lookout for here during the Thanksgiving and the rest of the holiday season?
Other than heart attack, heart failure is a very common reason why people end up in the hospital. Some of the symptoms to watch out for heart failure is shortness of breath and swelling in the legs. So those would be the two key things to watch out for.
Absolutely something that you have to keep an eye on. Have fun, be responsible, but also take care of yourself during the holiday season. Great information from cardiologist Dr. Fahmi Farah. Thanks so much, doctor, for joining us this morning. You have a great holiday season.
Thank you. You as well.